So, you've worked your whole life, paid your dues, and now you're on Medicare, thinking you're all set for retirement. But what if I told you that 5 huge, and frankly, essential health services aren't on the list of what's covered? I'm not talking about small stuff. These are shocking gaps that could leave you with thousands, or even tens of thousands, of dollars in bills you never saw coming. It's the kind of financial hit that can drain your savings right when you need them most. In this video, we're going to pull back the curtain on these 5 gaps and, more importantly, give you real strategies to get the coverage you need to protect yourself. The first major gap is a 3-for-1 shocker for a lot of folks. Routine dental, vision, and hearing services are not covered by original Medicare. That means no help with your regular dental cleanings, fillings, or dentures. It means no coverage for routine eye exams, glasses, or contact lenses. And, critically, you get 0 for hearing aids or the exams required to fit them. This is more than just an inconvenience, it can be a massive financial weight. Major dental work like a crown or an implant can easily cost thousands out of pocket. But beyond the money, skipping care in these areas has serious health consequences. Bad oral health can make chronic conditions worse. Poor vision increases the risk of a dangerous fall, and untreated hearing loss is tied to social isolation and even dementia. So, what can you do? The most common fix is a Medicare Advantage plan, since many of them bundle in some dental, vision, and hearing benefits. Just be sure to check the details, as these benefits often have yearly limits. Another smart move is to buy standalone insurance plans for dental, vision, or hearing. And if your income is limited, your state's Medicaid program might be able to help. The second thing Medicare won't touch is maybe the most financially scary gap of all: long-term custodial care. And this is a distinction that trips a lot of people up. Medicare might cover a short stay in a skilled nursing facility to help you recover after a hospital stay. But it absolutely will not pay for long-term help with daily activities like bathing, dressing, or eating if you have a chronic illness or disability. The price tag here can be devastating, with a private room in a nursing home costing over $120,000 a year on average. This one gap can wipe out a lifetime of savings in a flash. Many families are forced to spend down their assets until they become eligible for Medicaid. The only real way to handle this is to plan ahead. For those with lower income and fewer assets, Medicaid is the primary safety net for long-term care. For everyone else, buying a private long-term care insurance policy is the most direct way to shield your finances from this massive potential expense. It's a tough subject to think about, but you really can't afford to ignore it. Number 3 on the list is a big one for travelers. Your medical bills outside the US. With only a few rare exceptions, original Medicare provides 0 coverage once you leave the United States. If you have a medical emergency on that dream trip to Europe or while visiting family abroad, you're on the hook for 100% of the cost. A health crisis overseas can become a financial disaster in a hurry. If you travel often, filling this gap isn't optional. The best solution is to get a Medicare supplement plan, also called Medigap. Many Medigap plans have a foreign travel emergency benefit, which usually covers 80% of your costs up to a lifetime limit after a small deductible. Another route is to simply buy a separate travel insurance policy for each international trip. Number 4 is a problem that affects millions of seniors every single day: routine foot care. Original Medicare won't cover things like removing corns or calluses, trimming your toenails, or other basic foot maintenance that keeps you comfortable and on your feet. Now, this might not sound as dramatic as long-term care, but ignoring your foot health can lead to serious pain, trouble getting around, and infections, especially if you have a condition like diabetes. Medicare will cover foot care if it's considered medically necessary and tied to a specific illness or injury, but for the day-to-day stuff, you're on your own. How do you deal with it? Some Medicare Advantage plans might offer limited coverage for podiatry services. Otherwise, this is one of those out-of-pocket costs you'll just have to budget for as part of your regular self-care. And finally, the 5th thing Medicare says no to is any surgery that's considered cosmetic. This means procedures that aren't medically necessary, like a facelift or other aesthetic treatments, won't be paid for. Medicare's goal is to restore function, not to change your appearance for cosmetic reasons. The line can get a little blurry sometimes. For instance, eyelid surgery might be covered if it's proven necessary to improve your vision. But if the main reason is cosmetic, you'll be paying the full bill. So there you have it. The 5 big gaps in Medicare: dental, vision, and hearing, long-term care, foreign travel, routine foot care, and cosmetic surgery. As you can see, they can leave you exposed to some major financial risks. The key is to be proactive. If you found this video helpful, do me a favor and hit that like button and subscribe for more simple, clear advice on getting the most from your Medicare. The truth is, figuring out the right mix of Medicare Advantage, Medigap, or standalone plans is complicated. If you're worried about these gaps in your own coverage, the best thing you can do is get a personalized review. Click the link in the description to schedule a free, no-obligation consultation with our team. Don't wait to be blindsided by a bill you thought Medicare would cover. By understanding these gaps and making a plan for them now, you can make sure both your health and your savings are protected for years to come. You are invited to subscribe to Camaraderie Health Agency YouTube channel or go to www.camaraderiehealthagency.com or call 224-433-5754.